Hello, everyone. My name is Diane Hall, and I would like to welcome you to today's CDC Partner Update call on COVID-19. This call serves as a way for CDC to share weekly updates on COVID-19 and our latest resources and guidance, especially for the private sector and other partners. Today's call will focus on how to stay safe from COVID-19 during this election season. First, we will hear from our COVID-19 response acting chief medical officer about a status update and where we are with the response and what everyone should know about protecting themselves and others. Then we will hear from a member of CDC's Community Interventions and Critical Populations Task Force, also part of the response, who will provide an overview of CDC's considerations for election polling locations and recommendation for voters. Afterwards, our speakers will take questions from the audience. Please note this call is intended primarily for CDC partners directly involved in the COVID-19 response. It is not intended for media. Should media who are listening have questions, please feel free to reach out to media@cdc.gov. We are recording this call and it will be posted later on CDC's COVID-19 website, and we will also post it on YouTube. All of our past partner calls can be found there, so please take some time to review and please share the prior recordings with others. If this is your first webinar with us, these weekly calls occur every Monday at 3 p.m. Eastern Standard Time. There will be a link in the chat box to subscribe to our mailing list to receive future CDC COVID-19 Partner Update webinar invitations. We use several email lists when we send invitations for these weekly partner calls. If you've missed an invitation over the last few weeks, or if someone forwarded it to you, please do click the link and make sure to subscribe to the COVID-19 Partners email list. I would also like to take this opportunity to remind all participants that the CDC website has the latest information, guidance, and communication resources. There are over 2,000 documents providing information and guidance for individuals, businesses, and the public on our website. In addition to the guidance we will highlight today, some resources posted within the last week include updates to our air travel toolkit for airline partners to better assist our airline partners in communicating with travelers and employees about COVID-19 prevention. I'd also like to highlight two toolkits that were updated in the past week and are broadly useful, which are CDC's Toolkit for the General Public and the Social Media Toolkit. Both pages contain sample messages, fact sheets, posters, and other materials that are public and free to use. Topics include testing, prevention, contact tracing, and other critical issues. For those of you who joined us last Monday, you may be interested in CDC's page on strategies for protecting K-12 school staff from COVID-19, which was posted on Thursday. This page holds health and safety information for teachers, school nurses, bus drivers, music and art teachers, custodial staff, and other critical school staff members. Hopefully this will help answer some of the questions we were not able to get to last time. We will put links for all of these resources in the chat box. Thank you to those of you who sent questions to us in advance. We have already teed up a few of those questions, and we will be monitoring the Q&A box, so please feel welcome to submit questions. Note, we will not be actively viewing the chat box, so please use the full functionality of Q&A. It is located on the bottom panel of the Zoom window on your screen. I'm very pleased today to be joined by two CDC experts working on the COVID-19 response. Dr. Cliff McDonald is the acting chief medical officer for the COVID-19 response. He is filling in for Dr. Brooks for the next 2 weeks. Dr. Amy Kirby, as I said, is from the Community Interventions and Critical Populations Task Force, also on the response. Please note that today's call will feature several slides, but after Dr. McDonald's update. There are no slides for Dr. McDonald's portion of the update. If you experience technical difficulties or otherwise would like to review today's call later, once again, we are recording it and it will be posted on our webpage and on the CDC YouTube channel. And now I'd like to turn it over to Dr. McDonald for some updates.
Thank you, Dr. Hall, and welcome to everyone joining us today. My name is Dr. Cliff McDonald, and as mentioned, I am the acting chief medical officer for CDC's COVID-19 response, filling in for Dr. Brooks. Today, I would like to provide just a brief update on the COVID response at CDC and some of the latest scientific developments and guidance. First, a situational update. Globally, there have been over 23.4 million cases and over 800,000 deaths as of August 24th. This is roughly 304,000 more new cases and 6,000 new deaths since yesterday. Here in the United States, there have been over 5.6 million confirmed and probable cases reported to CDC, and tragically, over 175,000 deaths, which represent nearly 25% of all cases and deaths reported worldwide since the beginning of the pandemic, which is also more cases and deaths than contributed by any other country. Recent data suggests that as a nation, we are now in a decline in the number of daily cases. Over 3/4 of states have declining cases and very few are increasing. However, the number of daily cases across the nation still remains approximately twice of what we were seeing in mid to late June. As changes in deaths typically lag behind changes in diagnosed cases, the declines in deaths we are seeing are much less than the declines in cases. The degree of reductions in this current phase of the pandemic will continue to vary by state. The daily numbers of both cases and deaths remain quite high, and achieving control nationally will continue to depend on a strong public health response, including increased access to testing with shorter turnaround times of results for those who need it, and widespread adoption of non-pharmaceutical interventions such as social distancing, hand hygiene, masking in public, especially when you can't stay 6 feet apart from others, covering coughs and sneezes and avoiding touching your face, routine disinfection of high-touch surfaces, increasing ventilation, and of course, monitoring yourself and others for illness. We encourage you to visit CDC's COVID View for a weekly summary and interpretation of key indicators that have been adapted to track the COVID-19 pandemic in the United States. Now to say a few words about our recent MMWRs. Scientists around the country and world are working diligently to better understand how COVID-19 illness affects patients and communities. Today I will share some of what we've learned this past week from 2 reports from CDC that CDC has published in the Morbidity and Mortality Weekly Report, or the MMWR. I'd like to highlight first findings from an August 21st MMWR titled Trends in Number and Distribution of COVID-19 Hotspot Counties, United States, March 8th through July 15th, 2020. Throughout the pandemic, the geographic areas of the U.S. most affected by COVID-19 have changed over time. In early May, CDC and other federal agencies began identifying counties with increasing COVID-19 incidents. Looking across time from January to now, to better understand transmission dynamics and offer support to affected communities. Before March 7th, no counties met the hotspot criteria. Between March 8th and July 15th, 26% of counties were identified as COVID-19 hotspots. These counties included 80% of the U.S. population. The daily number of counties meeting hotspot criteria peaked in early April, decreased and stabilized between mid-April and early June, then increased again between late June and early July. The number of hotspots identified in the South and West has increased from March through mid-July. The impact of community transmission as a contributing factor increased over time, whereas identification of outbreaks in long-term care facilities, food processing facilities, correctional facilities, or other workplaces as contributing factors has decreased. Identifying hotspots allows for a focused approach for assessing localized COVID-19 outbreaks and implementing public health response activities in critical areas. For example, between May 7th and July 15th, CDC deployed 92 teams comprising 375 persons to 37 states in the District of Columbia. The majority of these deployments were related to hotspots. Efforts are underway to further improve how CDC identifies the most concerning hotspots and how to detect communities at increased risk for becoming hotspots. Rapid identification and characterization of hotspots will improve the timeliness and effectiveness of response efforts that can ultimately reduce the number of new COVID-19 cases. The second MMWR I want to discuss also has to do with hotspots, but is focused on the health disparities within these hotspots. This MMWR, posted on August 21st, is titled Disparities in Incidence of COVID-19 Among Underrepresented Racial or Ethnic Groups in Counties Identified as Hotspots during June 15th through 18th, 2020. 22 states, February through June 2020. Long-standing health and social inequities have resulted in increased risk for infection, severe illness, and death from COVID-19 among communities of color. This report identified 79 hotspot counties between June 5th and June 18th that also had sufficient data on race. These counties had a disproportionate number of COVID-19 cases among underrepresented racial and ethnic groups in almost all areas between February and June. Hispanic or Latino persons were the largest group by population size living in hotspot counties where a disproportionate number of cases among that group was identified, followed by Black, American Indian or Alaskan Native, Asian, and Native Hawaiian or other Pacific Islander persons. Disparities among these groups likely result from a multitude of conditions that lead to increased risk for exposure to SARS-CoV-2, including structural factors such as economic and housing policies in the built environment, and social factors such as essential worker employment status requiring in-person work and residence in multi-generational and multifamily households. Further, long-standing discrimination and social inequities might contribute to factors that increase risk for severe disease and death, such as limited access to health care, underlying medical conditions, and higher levels of exposure to pollution and environmental hazards. Developing culturally responsive, targeted interventions in partnership with trusted leaders and community-based organizations within communities of color may reduce disparities in COVID-19 incidence. COVID-19 has amplified existing health inequities and highlights the need for continued investment in communities of color to address social determinants of health and structural racism that affect health beyond this pandemic. More complete race or ethnicity data are still needed to fully inform public health decision-making and guide the allocation of resources at the county level. I have one last update to share before we move to today's speaker. Now that we're nearing the end of August, I'd like to remind everyone that the 2020-2021 flu season is coming up. With rare exceptions, the CDC recommends annual flu vaccination for everyone 6 months of age or older, especially during COVID-19. I encourage you all to get your yearly flu shot and encourage all partners on this call to support flu vaccination efforts within your organizations. September and October are great times to get the flu vaccine. With that, it is now my pleasure to hand you over to my colleague, Dr. Amy Kirby, to share information about CDC's considerations for election polling locations and voters. Thank you.
Thank you, Dr. McDonald, and good afternoon. My name is Dr. Amy Kirby, and I am with the Community Interventions and Critical Populations Task Force. I want to thank you all for joining us today. Today, I'll be discussing the COVID-19 considerations for elections, polling locations, and voters. On June 22nd, CDC released updated considerations for election polling locations and voters. This expanded guidance was developed in coordination with the Election Assistance Commission. CDC encourages election officials to work closely with public health officials in their jurisdiction to identify solutions that allow safer voting while adhering to local election law and the Americans with Disabilities Act. I'll provide a high-level overview today, but I encourage you to read the full document on the CDC website. I should note that the ability to implement some of these recommendations is dependent on the voting laws in your jurisdiction. Next slide. The posted guidance is divided into a section on guidance for election officials and poll workers and a section on guidance for voters. For the election officials and poll workers, the guidance is further divided into 3 sections: promoting healthy behaviors, maintaining healthy environments, and maintaining healthy operations. I'll go through each one of these sections to highlight the key considerations, as well as give you a brief overview of the recommendations for voters and some of the resources that are linked at the end of the guidance. Next slide. The guiding principles behind this guidance are to reduce crowds and reduce wait times, as well as promoting healthy behaviors among poll workers and voters. So the highest risk election structure would be in-person voting only on election day, because you'd have large crowds and likely very long wait times. Risk can be lowered by minimizing crowds, such as longer voting periods and alternatives to in-person voting, and minimizing crowds naturally reduces wait times as well. Next slide. So let's start with promoting healthy behaviors. We can advance to the next slide with content. Thank you. So promoting healthy behaviors includes all of the usual recommendations that you're used to seeing for any public setting. So we want to encourage poll workers to stay home if they're sick or have been in close contact with someone who is sick with COVID-19. We also want to encourage good hand washing, as well as frequent use of hand sanitizer containing at least 60% alcohol when hand washing isn't feasible. I will note that workers should not replace hand washing with hand sanitizer. You want to wash as frequently as possible and use hand sanitizer only when you can't wash your hands. We are encouraging universal face masks for poll workers and voters. We do note that some individuals should not wear masks, including children under 2, anyone who has trouble breathing, and anyone who could not remove the mask on their own. We also note that masks can make it difficult for voters with disabilities to effectively communicate. And so officials should have appropriate accommodations ready to assist these voters, such as written communications or clear masks or shields that facilitate lip reading. In all cases, we want to emphasize social distancing using signs, floor decals, chairs, or other reminders to maintain 6 feet of distance between individuals, and discourage physical contact such as handshaking. Next slide. These behaviors can be further supported through the provision of adequate supplies. So again, hand sanitizer containing at least 60% alcohol should be strategically placed, such as at the entrance to the polling location and the exit, at registration desks, and at the I voted sticker table. We all love that, so that's a great place for hand sanitizer. We do say not to put hand sanitizer at the actual voting station itself. Hands that are wet with hand sanitizer can damage electronic voting equipment and potentially smear the ink on paper ballots. So we want to keep it away from that station. And again, signage can be used in prominent locations to promote these everyday protective measures. Next slide. So the next section focuses on maintaining a healthy environment, which is really about keeping surfaces clean and crowd management. Next slide. So as with any public setting, efforts should be taken to minimize surfaces that are frequently touched by multiple people. So items that need to be reviewed, such as identification or poll books, should be placed on a table for review instead of handed person to person. Shared objects like pens or reusable ballot activation cards or ballot sleeves should be replaced with single-use items or disinfected between users. For those frequently touched surfaces that cannot be avoided or replaced, those should be disinfected routinely using disinfectants on EPA's list N. And I think we can put the link to that list N up in the chat box for you. Again, hand sanitizer should be provided for voters throughout the voting process, especially before interacting with poll workers and at the end of the voting process. We do note, however, that special care must be taken with the electronic voting equipment and ballots. Disinfectants and hand sanitizers can damage this equipment and can make ballots unreadable by smearing the ink. So officials should contact the equipment manufacturer for appropriate disinfection procedures for the equipment that's used in their jurisdiction. Our partner, the Election Assistance Commission, maintains a list of manufacturer cleaning recommendations for most voting equipment manufacturers, and that list is linked from the CDC guidance page. Again, hand sanitizer should not be supplied at the voting machine, but rather after voting is completed. And we encourage you to put signs up discouraging voters from disinfecting the machines themselves. Next slide. Crowd management is a critical component of safer voting. If possible, the number of polling locations should be increased and the hours that they are open should be lengthened. Lines should be moved outdoors if weather permits, so we want to avoid crowded lines indoors. It's also possible to identify larger facilities for polling locations, so that can make social distancing easier. And again, using floor decals can be a great way to remind voters to maintain social distancing. Next slide. We also encourage election officials to consider the layout of the polling location. It should be carefully considered to minimize physical contact and maximize physical distance. So as mentioned earlier, items for review can be placed on a table for examination. In places where physical distance cannot be maintained, such as registration stations, physical barriers such as plexiglass shields can be used to protect poll workers and voters. And voting machines should be spaced at least 6 feet apart. The traffic layout of the polling station should be modified to ensure that voters move in one direction using a dedicated entrance and exit to avoid bottlenecks where crowds can build. And again, signage and floor decals can be used to remind voters to maintain that 6 feet of distance and of the appropriate traffic flow. It's really important that voters should be notified of any changes to operations to ensure a smooth voting process and minimize the time spent in the polling location. Next slide. The next section is maintaining healthy operations, which is primarily focused on alternative voting methods. Next. So if it's allowed in your jurisdiction, we encourage election officials to offer alternatives that minimize crowding, such as mail-in voting, drive-up voting, and early voting. These alternatives should be accessible to voters with disabilities and consistent with the ADA. And again, voters should be notified of any changes in the voting options or process prior to Election Day to ensure that voting goes smoothly. Next slide. Special consideration should be given to voters with known COVID-19 or symptoms consistent with COVID-19. Alternative voting options should be made available for these ill voters. These alternatives should minimize contact between voters and poll workers, such as curbside voting or a designated polling site for ill workers. The poll workers assisting these sick voters should be provided with PPE, including respiratory protection, face shields, gowns, and gloves. And there should be signage on the door of the polling locations directing ill voters how to access these alternatives. Next slide. There are also several changes that can be made to protect people at increased risk for severe illness. Polling locations should be moved out of nursing homes, long-term care facilities, and senior living residences or other locations with vulnerable people. Polling locations and facilities that will stay in use, such as libraries or schools, should be set up so that voters are separated from facility users. So the polling location should have a designated entrance, exit, and restroom to be used by poll workers and voters that's separate from the other facility users. Poll workers who are at increased risk of severe illness should be assigned tasks that minimize direct contact with voters and other poll workers. And in all cases, non-essential visitors should be limited. Next slide. Handling mail-in ballots is a low-risk activity, but to further minimize that low risk, poll workers processing mail-in ballots should practice hand hygiene frequently. If mail-in ballots are handed in directly as opposed to sent through the mail, they can be held for 3 hours to further minimize any handling risk. The equipment that's used to process mail-in ballots should be cleaned and disinfected according to the manufacturer's instructions. And finally, mail-in ballots can be stored for record keeping as usual without any additional precautions. Next slide. The final section is focused on recommendations for voters. Next. So in addition to practicing good hand hygiene and good respiratory hygiene, which is coughing into a tissue or your elbow and then washing your hands, and wearing masks, voters are encouraged to choose voting alternatives or times that minimize direct contact and crowding. Voters can minimize the time they spend in the polling station by being prepared. So knowing their polling station, verifying their registration, reviewing the ballot prior to voting, and bringing any necessary documents with them. We also reiterate that voters should not disinfect voting machines themselves to avoid damaging the equipment. Next slide. This slide contains resources from the U.S. Election Assistance Commission and the Cybersecurity Infrastructure and Security Agency that you may find helpful. Our team can share these links in the chat, and they're also linked from our online guidance. Next slide. So I encourage you to read the full guidance that's linked here. It has a lot more details and links to other guidance documents that I was not able to cover today. I'd like to end by reminding you that local election laws and available voting methods vary widely. We encourage election officials to connect with local public health officials as soon as possible to discuss how to make voting safer in your community. And voters should learn about the voting alternatives that are available to them in their jurisdiction and make a plan to vote safely. With this, I complete my overview of our elections guidance, and I'll now hand you back over to Dr. Hall.
Thank you, Dr. McDonald and Dr. Kirby, for sharing those updates with us. We're now moving into questions and answer, the portion of our call today. We did receive some questions in advance, and we are monitoring the Q&A box in Zoom. I'm going to actually start with the question in Zoom, and Dr. Kirby, this one will be for you. We're getting a few questions asking about gloves for voters, for poll workers. What does CDC recommend?
Yeah, we are not recommending gloves either for voters or for poll workers. Practicing good hand hygiene, especially before you touch those frequently touched surfaces, is really the best approach. The only exception to that is, again, those poll workers that are assisting ill voters. They should have full PPE, including gloves.
Great, thank you. Okay, Dr. McDonald, this is sort of general, not specific to polling and election, but we frequently receive questions about getting care for other medical conditions during the pandemic. What does CDC suggest?
Well, first of all, it's important to continue taking care of your health and wellness. Certainly continue to take your medicines. Don't change your treatment plans without talking to your healthcare provider. Manage your disease the way your healthcare provider has and you have discussed. Always try to have on hand at least 2 weeks supply of prescription and non-prescription medications. Of course, call your healthcare provider if you have any concerns about your medical conditions. Unfortunately, we have sadly seen that people with serious medical conditions have delayed care because they were afraid of getting COVID at the emergency room or their doctor's office. But there are steps that medical practices and other ambulatory healthcare settings can take to reduce the risk of transmission from in-person healthcare delivery, both between patients, from healthcare personnel to patients, and from patients to healthcare personnel. These include things like triaging patients, reducing the number of patients in waiting areas, and then other measures to increase social distancing while they're waiting, use of masks by all patients, masks or appropriate personal protective equipment by healthcare personnel. Of course, increased use of telemedicine services is one of the best means to reduce the risk of transmission. And in fact, a very recent study from Boston was encouraging, as it demonstrated no association in the number of in-person prenatal care visits and SARS-CoV-2 infection among women who were pregnant. And so that's just one piece of evidence that healthcare facilities in the ambulatory settings specifically can take precautions and are successfully preventing any transmission. Of course, in any emergency situation, you should, of course, call 911. And then take care of yourself in the home setting. As we said, all these things covering your coughs and sneezes, mask out in public, and good hand sanitation, hand hygiene, excuse me. So that's how I would summarize what we should be doing and precautions that can be taken and are being taken. Over.
Thank you, Dr. McDonald. Dr. Kirby, we have another question. This concerns people who come to vote who are ill or displaying symptoms. Could you talk a little bit more about that?
Yeah, absolutely. So that's a very important issue that every jurisdiction will have to have a plan for. So definitely you want to have signage on the door discouraging someone with symptoms from entering the polling location. And that should also direct them to whatever alternative is in use in that jurisdiction. And different jurisdictions are approaching this differently. So in some cases, they are doing essentially curbside voting. So, there's a phone number and you call into the polling location and a poll worker comes out to assist you at your car. The ill person never gets out of their car. In other locations, they have decided to have a dedicated polling location set up for ill voters. And so then it would direct you to, the address of that polling location where you would vote as normal, but with workers that are appropriately protected to be able to assist ill voters.
Great, thank you. Is CDC recommending screening potential voters or taking temperatures, also poll workers?
We are not recommending that either for voters or poll workers.
Thank you. Does CDC have a recommendation or suggestion between fewer larger locations or more smaller locations?
We don't have a recommendation per se. It's really based on what layout will allow you to have the appropriate social distancing and crowd management. And again, different jurisdictions have taken different approaches. It's also impacted by the number of days and hours available to vote and how much that is spread out in time. So really, it's something that's going to have to be assessed by the local election officials.
Okay, Dr. Kirby, again, we have received a question, and I'm not sure you'll have an answer to this, but I'm going to ask it anyway. Are the supplies you're talking about for the polling site, are those typically provided by the state, or is this something that's handled at the local level?
Yeah, I don't have a set answer for that, but again, my understanding is that it varies from state to state, how that's provisioned.
Okay. All right, here's this is a delicate one. What do poll workers do if somebody comes in to vote but is not wearing a mask?
Again, that's going to be highly influenced by the local public health recommendations. So in places with a mask mandate, you might be able to be more forceful with the requirement to have a mask. But CDC doesn't have a statement on how to handle that.
Okay. There's also a question about the financial burden for the costs, and I'm assuming that also varies by state and locality.
Yeah.
Okay, great. Dr. Kirby, what do you suggest people bring if they decide or need to vote in person?
So depending on your local jurisdiction, bring whatever identification is required. If you are a first-time voter and you need additional paperwork, like to verify your residence, be sure to bring that. Again, review a ballot ahead of time so that you know who you're voting for and not, spending extra time at the voting machine. We also recommend that you bring a pen, either a black or blue pen, to complete any documents. So that you don't have to use a shared pen. And you might want to consider bringing a stylus as well that would work with the electronic voting machine. If you want to bring a stylus, we encourage you to check with your local election officials first to make sure that it's compatible with the machines that they're using.
Great, thank you. For poll workers, if they're not able to find manufacturer guidance on the voting equipment, what do you suggest in terms of cleaning and disinfecting?
Yeah, so I think that all of the election equipment manufacturers have provided guidance, but if there is one that has been missed, we do recommend wiping it down with a a 70% alcohol solution, and being sure to avoid any puddling of the ethanol because it can damage the equipment. We also recommend considering wipeable plastic covers, so you would maintain usability of the machine while protecting it from disinfection.
Great, thank you. Dr. McDonald, what should somebody do if they find out several days later after an employee has worked that they were diagnosed with COVID-19?
Well, if it's been less than 7 days since the sick employee used the facility, you should clean and disinfect all the areas used by the sick employee, following the CDC cleaning and disinfection recommendations. If it's been 7 days or more, additional cleaning is not necessary. That's in terms of cleaning the facility. Just continue routinely cleaning and disinfecting high-touch surfaces as usual. In terms of managing and taking care of other employees who may have been exposed to the virus, first consideration is whether there were any who were in close contact within approximately 6 feet of the sick employee for a prolonged period of time. If this employee is confirmed to have COVID-19, which is what you said, diagnosed with COVID-19, employers should inform the other employees of the workplace and of their possible exposure. But maintain confidentiality as required by the American Disabilities Act. Those who have symptoms should self-isolate and follow CDC steps. In most workplaces, those potentially exposed but with no symptoms should remain at home or in a comparable setting and practice social distancing for 14 days. That's quarantine. In case of critical infrastructure employees, they should follow specific guidance that we have for those individuals. And if they are instructed to return to work while symptom-free, they should wear face coverings at all times. And those are some specific instructions we have for
Thank you, Dr. McDonald. Let's see, Dr. Kirby, what do you recommend for poll workers who need to travel to get to the polling site?
Yeah, that's a great question. A lot of poll workers are going to need to use transit to get to their polling location. We have guidance available on the CDC website about how to use mass transit safely. And so we recommend that poll workers and voters read that guidance. If poll officials know that some of their workers are using transit to get to the location, it would be great if they could distribute that guidance or point them towards it so that they can use mass transit as safely as possible.
Great, thank you. We have a question in the Q&A box about ventilation considerations for polling places, options for air exchanges or ways to increase ventilation during voting, but also for people that are counting ballots.
I apologize. I was distracted for a second. Ventilation for people counting ballots, was that the question?
Or also voting.
Yes, or also voting. Yes, so we do have general guidance on ventilation. I recommend that they read that. Again, it's going to very much vary by the facility itself and how it is designed. So we don't have any standing guidance for that that would be applicable to all facilities.
Thank you, Dr. Kirby. This question came up last week when we were talking about the tools for schools to use, and we wanted to make sure that people understood that if you're using fans, you're not actually pointing them at people. You want to increase airflow, but not increase the risk that you are assisting droplets in their travel. Let's see. There's still a question about gloves. When CDC says we're not recommending gloves, is that any gloves or does that include disposable, like one-time use gloves?
That's any gloves. including disposable gloves.
Okay.
So again, the best defense is good hand hygiene. So washing your hands as frequently as you can, again, with soap and water for 20 seconds, and drying them thoroughly. Or if that cannot be accessed, then using hand sanitizer with at least 60% alcohol.
Great, thank you. Another one for Dr. Kirby. What do you suggest in terms of people bringing children to the polling places, or do you think that polling places may restrict who else enters the polling place?
Yeah, so there may be restrictions at the jurisdictional level. We are not recommending that necessarily as a restriction, but we do recommend that, this is not the year to take your children to vote, unfortunately, as much as I think that's a great thing to do. This is, as much as possible, we need to limit non-essential visitors to polling locations. So it really should just be poll workers and voters in the location as much as possible.
Great. Dr. Kirby, could you just sort of reiterate some of what CDC is recommending in terms of maintaining crowds and line management?
Sure. So again, this really comes back to making sure there's enough space to appropriately maintain that social distancing of 6 feet between people. So, consider increasing the number of polling locations available for early voting, or again, extending the hours of operation where possible. Maintain or increase the total number of polling places available to the public on election day to improve the ability to social distance. Unless there's no other option, we suggest not increasing the number of potential registered voters assigned to each polling place, because that would just make crowds worse. And we want to minimize lines as much as possible, especially those tightly spaced queues and small indoor spaces. So space out the lines, take those lines outside if the weather permits. And again, use those floor markings and decals to remind voters to maintain social distancing while they're in line. Again, as much as possible, if things can be outdoors, that would be great. There are also some jurisdictions that are pursuing alternatives like staggered entrance, so kind of a ticket system to get entrance into the polling location where you wait in your car. So those are other options that are possible depending on the jurisdiction.
Great, thank you, Dr. Kirby. I think those examples are also helpful. We have a question about delivering ballots to voters who may be ill. What type of PPE should they be using, and what should they be thinking about in terms of hygiene between location drops?
Yeah, so if you're delivering ballots directly to someone who is ill and you're going to have contact with that, close contact with the person who is ill, then definitely the deliverer should be wearing appropriate PPE, just like we're requiring or recommending for poll workers who are assisting ill voters. If they're being dropped off at a location where the ill person can pick it up, then you would not need that. If you're going between ill people, you would definitely want to follow the guidance for changing your PPE and practicing hand hygiene in between those different drop points.
Thank you, Dr. Kirby. We have a question in the box about what protocol should be used for a voter who cannot wear a mask because of medical reasons.
So, yeah, that's where the social distancing, maintaining social distancing, and those plexiglass barriers, those kinds of physical shields will be most useful. It's up to the jurisdiction. They may decide to provide other alternatives like curbside voting again for people that are not able to wear masks, but we're not making recommendations specifically on that.
Great, thank you. there's a couple questions in the chat that I'm assuming, Dr. Kirby, your answer is going to be, it depends on the jurisdiction, but I'd like to ask them anyway. So what about recommendations or options for somebody who wants to vote, but has been told they need to isolate or quarantine on election day? And clearly at this point, they would not have an early option or an absentee ballot option.
Yeah, again, so they would want to use the option that's available for voters who are ill or have had a close contact. We want to make voting available to all registered voters. And so that's why it's important for jurisdictions to have that option where people that should not be in public spaces will have the option to vote without that contact with other voters.
Great, thank you. This is also in the same category that I'm assuming it will depend on the jurisdiction. What about interpreters for people with disabilities?
I'm not sure if that's, can interpreters come along or will interpreters be provided? So certainly if you have an interpreter and you need to bring them, they should come. They would not be non-essential, they would be essential, and follow all of the guidance for other voters at the facility. To my knowledge, most voting jurisdictions do not provide interpreters on site, but they do provide communication resources. For example, headphones for listening to audio versions of the ballot. We have recommendations for cleaning those. We also have recommendations, for instance, for the masks that have a plastic insert to facilitate lip reading, and having written communications available to facilitate communications as well.
And those are on the CDC COVID-19 webpage?
Those are all on the elections page, yes.
Great, thank you. Okay, I'm not seeing more questions coming in, and it looks like we've gone through the questions that we received ahead of time. So, Dr. McDonald and Dr. Kirby, do you have any closing remarks or additional thoughts you'd like to share?
So I would just, again, recommend that people read the guidance online because there are more details there that we couldn't cover even with all of the questions. And this is definitely the year to make a plan and be prepared before you go vote. So you know what your options are.
Thank you, Dr. Kirby. Dr. McDonald, any
Yes.
closing thoughts?
Yes, I'd like to reemphasize everyone getting their flu vaccine, continue to follow CDC guidance for social distancing, use of masks and hand hygiene, and certainly also utilize everything we've been discussing, not only in polling, but also in all your daily activities. Thank you.
Thank you, Dr. McDonald. I'd also like to thank the support staff who made this possible. There are several people that are working behind the scenes to ensure that we're able to hold these calls each week, and I would like to thank them. Thanks to everyone for joining our call today. As I mentioned at the start of the call, we did record it and we will be posting it on our COVID-19 webpage. It will also be available on CDC's YouTube page. We included a link to subscribe to future updates and invitations. Thank you again, and please join us next week.